In Activity 5, we talk about a scenario of a 3-year-old who has missed some of her health appointments, and because of that they're going to be discharged from specialist care. We've asked you to think about what you would do and how you would manage this situation, and I think the first step really is to flag it to a clinician, because sometimes, not always, this becomes a safeguarding concern. It's really important to establish if A, we have sent the information to the right place. So do the family know that they were meant to have attended these appointments? Have they changed address or phone number? Is there a reasonable explanation as to why they've missed the appointments? If there isn't, we are almost in the grounds of considering medical neglect, so the family not taking the child to medical appointments. It is also important that we clarify that not all medical appointments are as important as each other. So when we talk with clinicians about children who are not taken to health appointments, we often talk about what does that mean for the child. Is the child likely to suffer harm? So if the child needs a review or a medication for their heart, or their epilepsy, or their asthma, and they are regularly not being seen, they may ultimately die because they're not receiving the right treatment. And this is definitely in the arena of safeguarding. However, there are a number of other health appointments, although we find them very important, that they don't have the same level of consequence by the children not attending them. There's also a degree of consideration required as to the family's needs and wants. So have the family received all the information, and have they made an informed choice not to take up certain treatments? For example, immunisations. Families are entitled to decide if they want to have immunisations or not. And as a health service, we can't force them to change their mind. We can only offer them the information and let them make their decisions. It may be that your clinician, your GP or your practice nurse will ask you to book a face-to-face appointment with the family so they can be seen at the surgery, and all of the things I spoke now can be discussed and followed up. It may also be that you have to be familiar and follow your local missed appointments policy just to make sure that these children don't fall through the gap.